Okay, good evening to everyone. It's really a pleasure to have this brief webinar on evolutionary aspects and look at personality and personality pathology. We are going to start with Martin Brune, who is one of the most famous experts in the field of evolutionary psychopathology. Martin is professor of psychiatry, head of division of the social neuropsychiatry in evolutionary medicine and the LWL University Hospital at the Ruhr University in Bochum, Germany. And he has authored many articles and chapters in the field, especially he authored the Oxford textbook of evolutionary psychiatry, which had its second edition in 2016. And Martin is going to introduce the evolutionary aspect of personality pathology and how this field may inform not just psychopathology, but also psychotherapy. So please, Martin, feel free to start.
Yeah, buonasera tutti. Thank you very much for your kind introduction, Simone, and for inviting me to join you in this webinar. I'm very happy to be with you and would like to present a few ideas about the evolutionary background or potential evolutionary background of personality dimensions. Right. So as we all know, personality can be defined as a set of characteristics and behavioral dispositions that are based on both temperamental and developmental components that are presumed to be relatively stable across time, lifetime, and contextual factors. There are meta-analytical studies showing that early childhood temperament is related to the development of later personality traits. But childhood and young adulthood seem to be associated with the highest level of change with respect to personality. And also, we should not neglect the fact that temperament and personality traits seem to be, at least in part, under genetic control, with an estimated variance explained by genetic factors between 25 and 50%, which on the other hand implies that a similar amount of statistical variance is explained by environmental factors. So the question is, what do evolutionary approaches contribute, or what can evolutionary approaches contribute to the explanation of personality? And as you can see on this slide, there are quite a few divergent views on that issue. A very broad definition is that human personality has consequences on evolutionary fitness, including survival and mating success, number of children, etc., etc. That's a broad definition taken from a quite recent article published by Hunt and Yegi. But as you can see below, there is disagreement about what genetics have to do with differences, individual differences in personality, especially views that contrast quite profoundly, where one camp of evolutionary psychologists suggests that personality is relatively selection independent and more or less random, or random effects following sexual recombination, and that differences in personality traits are more or less non-adaptive phenotypic variants that have no deeper meaning. I believe that Simone and myself would disagree on that and would rather go for David Buss' argument that individual differences in personality are a central aspect of what he called the adaptive landscape in which humans evolved. And a couple of others have argued that individual differences in personality evolved to reduce competition among members of the same species and, so to speak, to fill different social niches within a given community. So from an evolutionary point of view, I personally find it very interesting that personality or difference in personality is nothing human specific. This is a quite provocative slide indicating that even among ant species and ant colonies, there are differences between different colonies. For example, in terms of boldness, where one colony of given ant species shows bolder behavior compared to another colony, however, at the cost of higher mortality rates among the workers. So where on one hand, the bold strategy can be called adaptive because the colony is better at food extraction from the environment, it comes at the cost of higher mortality of ant workers in that bolder colony compared to the less bold colony. So they take more risks, in other words, and continue, for example, to forage, even if the temperature is higher than the usual temperature that the species can tolerate. And this leads to higher mortality. Certainly, animals that are more closely related to ourselves, foremost other mammals, have different personalities. If, for example, if there are among you dog owners, you know that your dog has a kind of personality that may differ from other dogs, same for cats, etc., etc. The point I would like to make here is that we may try to explain differences in personality when we apply an idea taken from behavioral ecology that is called life history theory. Life history theory was originally developed for the comparison of different species in terms of their speed of maturation, number of offspring, lifespan or longevity, in other words, and also body maintenance, including immunological functioning. So the idea is very simple. Behavioral ecology suggests that an individual of a given species cannot invest in reproduction and body maintenance at the same time. So it either favors reproductive success, meaning number of offspring is large, or into somatic growth. And you can see here the example when we, for example, compare a rat with an elephant, you see what is meant by the contrast where the so-called fast life history strategy or R-selected strategy is associated with fast reproduction but low survival rates of the offspring. The number of offspring is particularly high, but the individual invests relatively little energy resources in body maintenance or somatic maintenance. And the opposite strategy is the so-called K-selected strategy, which suggests a much slower life history pace. It's associated with slow reproduction, high survival rates of offspring, but low numbers of offspring and high somatic body maintenance. So this means, for example, that an average elephant cow, a female elephant, can at best have up to 10 elephant calves, not more, whereas a rat can have in its lifespan of perhaps 2 years hundreds of offspring, where very few of the rat offspring survived, but the elephant calves almost always survive until adulthood. And this is also the reason why elephants almost never get cancer, because the investment in somatic maintenance is so high, and this includes the immunological function, whereas this is not the case in fast developing species like rats, mice, etc. So this is the basic idea. And now, of course, the crucial question is it allowed to transpose this idea from comparison between species to comparison within species? And this is still hotly debated, especially among evolutionary biologists, a little less so among evolutionary psychologists. But in any way, from the perspective of life history theory, individuals should adjust risk-taking behavior to their residual reproductive value, which is their future fitness, where individuals with high expectations should be risk-averse, akin to slow strategies, and individuals with low expectations should be relatively risk-prone. And so we have here already a hint what this could mean for personality traits. I would just briefly like to mention that the only well-known evolutionary theory in psychiatry and psychotherapy is attachment theory, even though it's usually not perceived as a deeply grounded evolutionary theory. But John Bowlby originally worked with evolutionary biologists rather than with his colleagues from the psychoanalytic camp, which in the first place rejected his ideas. But this would be another talk. Interestingly, Bowlby himself believed that only what he called secure attachment was biologically adaptive, whereas more recent research from evolutionary psychologists suggests that under specific circumstances where environmental conditions are unstable, insecure attachment might be advantageous over secure attachment. Some 30 years ago, Belsky, Steinberg, and Draper published a fabulous, still very highly recommendable paper about what this life history approach could mean for the understanding of social, psychological, and biological development in our own species. So you see here on in this graph the type 1 and type 2 reproductive strategy, if you like, where type 2 is similar to a fast strategy and type 2 similar to a slow strategy. So for example, if you find in families high levels of marital discord, high stress, perhaps poverty or other reasons for inadequate financial resources, this situation makes it, statistically speaking, more likely that parents adopt a harsh, rejecting, or insensitive, or perhaps even inconsistent child rearing style. This in turn is associated with a greater likelihood that the children themselves develop insecure attachment styles, what Bowlby called mistrustful internal working models, and perhaps a more opportunistic interpersonal orientation, which is fine and consistent with life history theory approaches if you accept that it's possible to use that concept for differences, to explain differences between individuals of the same species, like ourselves. Interestingly, it seems that this sort of fast track, if I may call it like that, is apparently associated with earlier biological maturation and earlier puberty, perhaps earlier sexual activity, and perhaps short-term unstable pair bonds later in life when the kids are grown up. And type 2 is kind of opposite trajectory, leading to a slow life history strategy, whereby I have to say, I believe there are many psychotherapists in the audience. The term strategy, of course, does by no means imply conscious decision making or conscious selection of a certain behavior or trait. So from a theoretical perspective, it would make sense that the fast strategy makes more sense in harsh and unpredictable or unsafe environmental conditions. And the other one is perhaps more typical for more predictable environmental conditions. Now, if we try to break it down with regard to personality traits, we could find differences where things like impulsivity, risk-taking, short-term thinking, aggression, violence, substance abuse, etc., are more likely to occur in the fast life history condition compared to what is predicted to be found in the slower life history condition. For example, careful consideration of risks or risk aversiveness, one could call it, long-term planning and thinking, pro-social behavior, etc., high parental investment. Marco del Giudice, who is now in Trieste, has suggested that even when you look at the big 5 personality traits, you can find differences between fast and slow spectrum, both psychology and psychopathology, where especially conscientiousness and agreeableness seem to aggregate with either a fast or a slow life history strategy. So, for example, low conscientiousness and low agreeableness seem to be more typical for a fast strategy, where high conscientiousness and high agreeableness are more likely associated with a slow life history strategy. The other factors I have mentioned previously, like risk-taking versus risk aversion, sensation-seeking, novelty-seeking versus preference for routines, etc. So before coming to the topic of personality pathology, I would like to highlight this study from a community in rural Senegal, which is a polygynous society. And with regard to the 5-factor model, a French group examining people from that community found that, in fact, neuroticism in women is associated with an increased number of children. But what you see on the right-hand side, neuroticism is also associated with poorer nutritional status of the children, meaning that there is an inverted U-shape-like curve suggesting that the highest reproductive success is when neuroticism is in the middle range, not too low and not too high. In the same community, it's different for the men, where extraversion, as one of the other 5 factors, is related to fitness. For example, social status, number of spouses or women they mate with, and also with the number of children. So this supports the idea that personality traits are not evolutionarily random, but have a certain function related to reproductive success, which is, so to speak, the biological currency for all living creatures. And now the question I would like to very briefly discuss with you is whether this is also true for personality disorders. For example, borderline disorder. You certainly know the criteria according to DSM-4 and now DSM-5 for borderline disorder. And what we did in the past was to examine what is called the pace of life. This addresses fast versus slow life history strategies. And we try to relate this to the diagnosis of borderline personality disorder versus psychologically healthy people. And we found that indeed the indicator for a fast life history strategy was more common in the borderline group, which is shown here by the red column on the left-hand side, whereas a slower life history strategy was found in psychologically healthy people. And this is what we found with regard to the 5-factor model: higher neuroticism in the borderline group, lower extraversion, lower conscientiousness and agreeableness in the clinical group. And please don't study the entire table here. On the left-hand side, you see the scores for the life history strategy according to Figueredo, who developed that scale, the Arizona Life History Battery. We found quite a few correlations, for example, with childhood trauma, with aggressiveness, with the 5-factor models, all going into the same direction. Based on the hypothesis that people with borderline personality unconsciously follow a fast life history strategy. And it also seemed to be consistent with what we found when we looked at attachment styles, where I would think counterintuitively, we found that people having an enmeshed or anxious attachment style or fearful attachment style had greater sexual risky behaviors than individuals who were more securely attached. But here's the problem. The problem is that biologists would claim, hey, where is the somatic corresponding accelerated speed of maturation. And this is what we actually did not find. So women with borderline personality disorder did not differ from controls with regard to menarche and other signs of somatic sexual development. So the physical correlates of life history actually were not shown in the clinical group. I think I'm a bit running out of time. So one short comment. We found that externalizing behavior was more pronounced in the borderline group than in the control group, and found that externalizing oriented thinking was inversely correlated, although just at point -2 with the onset of menarche. So indirectly, it could indeed fill that gap that I just mentioned, that perhaps some personality traits in people with personality disorders like borderline disorder may mildly be associated with the speed of somatic maturation. But I think we need definitely more research and more data to confirm this. This graph shows basically the same. And now, at the end of my talk, I would like to show you kind of warning sign, because we cannot be sure that the whole story is really true. This is a quite recent publication about the fast-slow life history continuum in contemporary hunter-gatherer societies. And what Anthony Falk actually found in his research was the exact opposite of what I just was talking about. So, in other words, slow life history strategies were not related to environmental security. Indeed, it was the opposite, that a fast life history strategy was more prevalent, and this in a way contradicts what Belsky, Steinberg, and Draper proposed some 35 years ago. So indeed, benign living conditions were in that group associated with earlier sexual maturation and growth, earlier reproduction, and greater total reproduction, which is the opposite of what evolutionary psychologists have predicted. So perhaps it could be that what we are talking about is more or less specific to our cultural environment, the Western, or what other people call the weird societies, Western educated, intelligent, and well-educated societies. So here's my take-home message. From a behavioral ecology point of view, variation in personality can be seen as an adaptation to environmental contingencies, serving the purpose of optimizing reproductive success. And personality disorders, I believe, can be seen as the extremes of normal variation rather than being categorically distinct from normalcy. And Simona will, I presume, go into details with regard to the dimensional versus categorical approach. But still, there are many open questions. What is the role of early adversity or early experiences, attachment? Are psychological strategies perhaps distinct from biological maturation? Or could it be an artifact of modernity? I think this is these are important questions for future research. But I would close my presentation for now, and thank you very much for your attention.
Thank you very much, Professor Brune. As you can read in the chat line, if there are any questions, would you please write it down in the chat line? And
yes,
if we have enough time, we will discuss them later, because I just want to ask a quick question to Professor Brune, and then we will listen to Simone's speech. Very quickly, but I'm really interested in it. As Simone was telling you, I was a pupil of Giovanni Liotti, but apart from this, in our country, as you might know, there has been a relatively early impact of the evolutionary outlook on the clinical field through the work of Giovanni Liotti that was initially inspired by John Bowlby, but then also by other contributions, mainly coming from Paul Gilbert and Lichtenberg, the so-called multi-motivational theories. My question is, how would you think that the current evolutionary framework can inform the clinical work from now on? And now this framework can contribute to fine-tune this first attachment-informed version that we received.
Yeah, thank you very much, Maurizio. This is a very important question. I think we kind of have arrived at the next level, if I may call it, and we need to explain whether or not evolutionary perspectives can, in fact, improve treatment of people with personality disorders. So if we can find agreement that attachment on one hand and perhaps life history strategies can inform the understanding of personality development and personality disorders, we now need to think about what does this mean in terms of modifications of treatment approaches. I don't think we need to invent a new kind of treatment. I think Simone will talk about evolutionary systems theory in the next minutes. But theoretically, I think it could be very fruitful to include these approaches and, for example, make clear to individual patients what their behavior actually expresses, and depending on the environmental conditions in which individuals live, it might be helpful to show them that, for example, slowing down, if I may use these terms, slowing down their life history strategies could be a good development for their lives and future developments.
Thank you very much, Professor Brune. Now I'm just
Thank you.
quickly introducing Professor Simone Kelly, PhD, professor at St. John University in Rome and director of Tagios Charity in Florence. And Simone is the person who has organized this webinar too. So please, Simone.
Okay, thanks, Maurizio. Thanks, Martin, for a very detailed and nice introduction to the topic. And I want to just start summarizing that we are trying to collect evidence with different colleagues around the world, following what Martin was suggesting. So Martin is one part of the team. So the idea is to try to better understand how an evolutionary form conceptualization may be useful, not for a single approach, not showing that what I'm doing is right, but rather that this wide and complex background that Martin was presenting may help in better focusing on this complex challenge that is psychotherapy. So the goal of my presentation is to try to offer a perspective we are working on in order to do so. It is to try to integrate these complex evolutionary models into the clinical practice. So the question at the core is that we as humans has always struggled with the challenge of trying to understand and predict somehow the other's behavior, both in adaptive and maladaptive, even pathological terms. And this challenge is enduring as much as is part of the actual debate on personality and personality pathology. In a quite recent paper, Chris Offel suggested to better focus on the integration between personality and clinical psychology. There are two fields that basically talk about the same stuff, but just using different words. And that's one of the main problems, especially in the psychological field. The background presented by Martin, and that is the theory of evolution, offers a lot of useful tool, starting from, for example, the 4 Tim Bergen's question about how to understand the behavior, that is to understand how it did evolve over time in the life of the species, I mean phylogenetically, and in the life of the single individual, that is ontogenetically, but also to try to understand the mechanisms and functions beyond that threat. And this is not just theory, it's something that, as Martin was suggesting, I am suggesting, it can be a very practical tool when discussing with the client. The reason why is they are struggling with certain problems. And life history here, I'm not going to in detail. Martin have explained what does mean this model, as offer us a useful way to think about these challenges. I would just focus a bit on a theoretical tool and experimental tool that I find very useful when talking about evolutionary frameworks, or evolutionary look at humans, the so-called social brain hypothesis. That is, when we talk about humans, we always have to put their behaviors within a social framework, because what we know is that the reason why we have so complex brain is because primates before and humans later needed and need large brain has complex hardware, complex devices to cope with unusually complex society. And widely studied areas of psychopathology such as schizophrenia are not randomly better explained by understanding impairments in the very area involved in these social processes, such as obviously the so-called social brain. So the model I'm presenting here, that is going to be a chapter of upcoming book of Cambridge University Press on new advances in personality that Martin and I have written. It's just an attempt to offer a tentative, unique framework to put different elements together, and again, focusing on the practice of psychotherapy. That is not just tutorizing, but okay, how do I explain all this stuff to a client? The idea is to have somehow 3 different levels corresponding to a basic organization that would define the configuration determining the essential characteristics of the system, and the structure that is the resulting, possibly maladaptive embodiment of this organization that through recursive failure in adaptation may lead to what we call personality pathology. This is extremely important in clinical terms, because if we understand that what we work with in a psychotherapy room is this resulting maladaptive structure, this means that targeting, trying to change the basic organization would be iatrogenic, would be maladaptive for the therapist, for the clinician, where instead understanding the strategies, the meaning of the strategies, and how they fail and when they failed, that's important, that may be useful for the client. So here you can see a more easy to understand version that is an application in a single case. She was a 90 years old woman that during the assessment was diagnosed with borderline personality disorder, obsessive-compulsive personality disorder, and anorexia. She told a life history defined by in early ecological needs. This is the family environment she lived in, as defined by emotional neglect and even different form of abuses. On the other hand, she described herself, or was always described, as someone with what we may define in personality terms a high neuroticism, that is the tendency to experience intense negative emotions, having an idea of the world as somehow a scary place. But at the same time, she was presenting what is in cognitive terms defined as a low reward sensitivity. That is, she has always been capable to postpone her reward to collaborate with the other. Progressively, she tried to use these basic characteristics to cope with the threatening environment she was living in. As I said, she experienced, unfortunately, several forms of abuse and neglect, developing different inhibitory processes in terms of self-criticism or control, and consolidated, solidifying a few shared social motifs in terms of an exaggerated processuality and a hyper-investment in caring, considering the other. Again, to the final end, that personality may be defined as high level of negative affectivity and a high level of anacasia. So this is our attempt to put together what we know in terms of dimensional and hierarchical approach to psychopathology, broadly speaking, specifically to personality. And in order to offer a simplified initial understanding of the different interpersonal styles, different interpersonal strategies, defining the core symptomatology, the core personality pathology, we have tried for research to describe three main interpersonal styles that we define in terms of perfectionistic, schizotypal, antagonistic styles corresponding to the three main spectra of psychopathology, that is internalizing, schizotypy, and externalizing spectrum. So the idea is that we may describe a style as being hyperaffiliative, where the other is a sort of external validator, and this perfectionistic style, we know that is associated with prominent interpersonal symptom and may be defined, evolutionarily speaking, as a risk minimizing and somehow hyperaffiliative strategy, where instead the schizotypal threat will consider the other as a sort of threat to the person's well-being or sometimes even survival. Think about, I don't know, paranoid ideation, and has been extensively associated with greater risk for symptoms associated with psychosis and schizophrenia, and with a sort of risk minimization, such as detachment, and uniqueness maximization strategy. Think about thought behavior, thoughts, and so on. Finally, antagonistic style will refer to considering the other as a sort of obstacle in accessing one's well-being or value, and has been extensively associated with externalizing symptom and may represent a gain maximization strategy. If we think more in terms of in a less stigmatizing way, that is in not necessarily pathological way, we are describing a pattern that may recur becoming a style where more affiliative, more defensive, more distancing. Again, in a way, I'm associating myself, I'm dealing with others. And again, this not necessarily implies a pathology. So let me skip this. We recently conclude a research where we try to test these hypotheses. So it's a very preliminary pilot study. So as you see, the sample is very small. It's just a kickstart to understand that our methodological tools and our clinical rationale may have sense. And so to later prove that in larger samples. What we have tried is to test these three interpersonal styles in patients diagnosed with personality pathology, and focusing just on the very age where we suppose that we are developing the social brain, that is adolescence in wider terms, from 16 to 25 years old. In those clients recruited, we use evolution system therapy, that is a novel integrative form of therapy that is based on this evolutionary form conceptualization. It's not the focus on the topic, but just to explain what we have done. The intervention is based on having a main initial step that is sharing with the client this very evolutionarily based conceptualization. Then, as I said, is an integrative therapy collecting initial evidence, let's say promising evidence, but preliminary evidence. Let's focus, because I don't want to waste your time. It's late in the evening. So in the study, we tried to explore, as I said, the feasibility and reliability of this broader conceptualization approach based on evolutionary psychopathology. So we recruit the minimum sample size based on what is ecologically momentary assessment. That is an approach for those who are not familiar with, where rather than asking pre-post, asking the client and with pre-post measures, you ask the client to fulfill daily, a few times per day, the same short measures, so as to have a better ecological understanding of how they deal with their daily challenges. In terms of feasibility, safety, and efficacy of the intervention, we collected promising results, in the sense we didn't have dropouts. As I said, just 21 clients, so it's not a quantity outcome, but it's interesting in terms that possibly this evolutionary form conceptualization and model is sufficiently safe, is perceived as useful by clients. Otherwise, possibly we would have rather lower attrition rates and a lower attendance rate. At the end of the intervention, we collected a significant reliable reduction, both at the individual level, that is using single case methodology, assessing changes in one by one client, and the group level, that is using, for those interested in, repeated measure ANOVA to confirm that there was a significant change in both personality function, that is criterion A of AMPD, and in maladaptive personality traits, that is criterion B of AMPD. Moreover, 19 out of 21 of the clients remitted from diagnosis. But let's go to the more interesting part. I mean, consistently with the topic of this webinar of today, when using ecological momentary assessment, we found that is a few outcomes, a few findings that are consistent with the model I was describing before. Because first, each style was prominent in the corresponding spectrum. That is, for example, the schizotypal style was prominent in the group of clients where we found a prominence of schizotypal traits and personality traits that are related to that. So we assessed using a measure, that is spectrum index of psychopathology, to confirm symptoms related to thoughts disorder, to reality impairment, and we found that they were showing greater levels of psychoticism and detachment. Similarly, we found the same results, same findings for perfectionistic style, for internalizing spectrum, and antagonistic style for externalizing spectrum. Moreover, when we try to correlate the interpersonal styles that, by the way, were assessed by asking the client twice a day, how did you react? How did you deal with an interpersonal situation where you were dealing with the significant others of your social network? And the client was asked to choose one of the three styles that was previously explained at the beginning of the sessions. So we didn't find significant or more than negligible correlation between the interpersonal styles and the level of mood and the level of personality functioning, meaning that the interpersonal style is a feature of the personality and not necessarily a predictor, a tight predictor of the pathology. This is consistent with what we're saying, in the sense that the basic organization is not something is going to change by psychotherapy. The goal of psychotherapy is to help clients acknowledging what are their automatic or semi-automatic strategies, when they work, when they don't work, and how to develop new and hopefully more adaptive strategies. Similarly, we didn't find that interpersonal styles changed over time. There were only 4 exceptions. There were 2 clients with antagonistic styles and 2 clients with schizotypal styles that reported an increase of perfectionistic interpersonal style. And possibly this is consistent with a greater processuality at the end of the intervention. So, going to the end, we collected promising albeit preliminary evidence about the consistency of their personal styles and the intertwined relationship between dynamics as more temporary, transitive, state-dependent dynamics patterns, and style has features related to my organizational personality that recur over time, not just today, but tomorrow and the day after, and so on. We, in the next few months, we are trying to collect more results. Especially, we have recently registered a protocol to explore in 5 countries, that is Italy, USA, Spain, Poland, and China, the feasibility, cross-cultural feasibility and acceptability of this evolutionary form conceptualization. And this will be tested by clinicians with different approach, cognitive, psychodynamic, and integrative approaches. And also we have recently registered a new study to better explore interpersonal style using the less stigmatizing label I was presenting you before, and also asking the persons to rate the intensity of the style, because in the study I have presented, we forced the clients to choose one of the 3. So this was useful as an initial understanding of the question, but may have been a bias in a fine-grained, nuanced understanding of the problem. So I have concluded. I have to thank you, Martin, and all the other colleagues that have contributed to these studies and are going to help me in the next few studies. So thank you.
Thank you, Simone. I don't know if we have time for a quick question, maybe. Simone, what do you say? Well, very briefly, I'd like to ask you, Simone, something about just only a hint about these 4 modules or steps, because the 3 styles, you have to know that were inspired by 3 dogs. So it's as simple as this. Take 3 dogs and take them to 4 steps. Can you just say something about these 4 modules?
Yeah, let's say the intervention, as I was saying, is based on 4 modules. There are not separate compounds, but rather primary targets of the intervention that may recur over different phases, among different phases of the intervention, but also within the same session. The idea is to primarily focus on the conceptualization model I was presenting, because I guess that it's very important not to offer a conceptualization that is stigmatizing and may offer great degrees of freedom to the client, that is understanding how my personality is defined, what things I can change, what things I can protect, improve, or take care of. Then we have tried to define two general targets in the sense that are obviously abstract definition, as the model is a heuristic and not a real object, but we have tried to distinguish intervention aimed to work on self to self and self to other relation, in the sense that my way to relate myself to my inner experience and my social life. In doing so, we try to integrate autobiography techniques, because we need to share with the client the model, experiential techniques to better discuss this shift from my organization personality to my embodiment. This is the final structure, and obviously relational techniques, because I think that since we are social animal and this model is quite interpersonally oriented, the relationship between the clients and the therapist is the most important and more easy to access tool. But again, this is how do we work. I guess we are more interested about how we can use the theory of evolution to inform conceptualization beyond the single model of intervention.
Thank you very much. So, some final comments. Simone, would you take us to the end?
Yeah. Again, thanks. I would like, again, thanks to you, Maurizio and Martin, for being here. The goal of today to me was to have Martin introducing us the importance of this evolutionary background and try to show you an example that is our attempt. Again, I do not think it's the right attempt. I hope that our goal is to share the importance of making attempts to inform psychotherapy with evolutionary theory, because it's a very trans-theoretical and flexible tool to me, and can be used by different approaches. In our team, we have people with transference focus, psychotherapy approach, constructivist, CBT, and so on. So, and as Martin was saying in the end, more research is needed. I don't know, Martin, if you wanna say, if you have a few words for the end, or a final comment.
Thanks, Simone. I particularly liked your presentation and the new perspectives with regard to the different styles that you defined. And I think this is a very fruitful approach that across therapeutic schools, therapy can benefit from. And I look forward to learning more about it in the near future from you. So thank you very much for inviting me, and that was really, really nice, very nice evening and presentation. Thanks a lot.
Okay, thank you everybody for having joined us. Thank you again, Martin and Maurizio, and have a good night to you all.
Thank you.